Hello. So I've talked quite a bit recently about PMDD over on my Instagram, and quite a few people have messaged me and said, I think I might have it. What is it? Tell me more about it. So I thought I'd do a little video on what PMDD is. I don't think everybody knows about it. I certainly didn't. I'll talk about how it affects me, diagnostic pathways and things like that from my experience. So I'm not a medical expert by any means. So PMDD is postmenstrual dysphoric disorder, and it presents itself differently to different people. It's really important that people understand that it is not PMS. It's a much more significant and extreme version of it. But also with that, we also have to recognise that PMS is a really serious thing for a lot of people. It's really significant. It's really important to them. Some people experience it quite badly. So I'm not dismissing PMS and PMT, but PMDD is something a little bit more. So again, everybody experiences it quite differently. It happens in the luteal phase of your menstrual cycle. So it happens between ovulation and menstruation. And for some people, it might be significant for that whole period. For some people, it's the week. It might be 4 or 5 days. But what's really key to understand is that the impact is significant, and that's what makes it a disorder as opposed to PMS or PMT. So what does it look like emotionally? So high levels of anxiety, potentially depression, sometimes suicidal ideation, overwhelming emotions. So not just feeling sad and feeling a bit grumpy, but emotions that overwhelm you so much that they're going to impact on your day-to-day functioning. Fatigue, falling asleep, fatigue, just physically feeling fatigued, emotionally feeling fatigued, really aggressive a lot of the time. So some people get really aggressive. Some people just really struggle, might have a high fear response and those sorts of things. And I remember reading about it and reading some different ways in which people had said they'd experienced it, and one person said it was like a pet pressed a self-destruct button once a month and start destroying my relationships and things like that. So and I think that's the important part of recognizing why it is different to PMS, or why it is additional, is that kind of next step up, that most people with PMS might have a really crappy week and it's awful, but they don't start to sabotage things. They don't I write my notice out for work every month, and luckily I've learned to manage it so I don't send it, or I get incredibly angry at people or who've done nothing wrong, and those sorts of things. So it's that inability to function, and it affects your functioning in general. So other things that can happen is you get become kind of a rejection sensitive dysphoria. So you feel everyone's rejecting you, nobody wants to be your friend, no, everybody's out to get you, those sorts of things. So I suppose there's an element of paranoia, and also brain fog, difficulty concentrating, difficulty focusing. The other thing, the other kind of symptoms are more physical. So muscle fatigue, muscle pain, sometimes kind of shooting and almost like electricity type pains in your muscles, significant breast pain. That's one of the main symptoms from a physical side for me. So kind of shooting pains, stabbing pains, just generally aching, that sort of thing. Bloating, which people might get anyway, but bloating and cramping to the level of a significant period. Just generally physically feeling like crap. And for a lot of people, what that can mean is that it puts them out of action for often a week to 10 days every month. And we, as women, we're often told, oh, it's period pain or it's PMS, and we're just expected to get on with it. And I think it's really important to understand how this affects people. For me, if I'm not teaching, I do have some flexibility in my job, so I can work from home the majority of the time. And on my week where it's most significant for me, which mine lasts 5 to 7 days, I have to be at home, and I have to kind of break up the day of doing a bit of work, sometimes having a nap. So I'll start work really early and maybe finish later because I'm just to get my hours in. Concentration's really hard. So if I'm marking, I really struggle to mark in that week because I'm just not giving the students' work what it deserves. I'm just not there. I'm cranky. But also I genuinely feel like everybody hates me and everybody's out to get me. Having over the last couple of years understood what PMDD is and how it affects people, I think that has impacted the way in which I manage it. So thinking about kind of diagnostic pathways and those sorts of things, I think it's really important to recognise that certainly my experience is that it's not diagnosed generally in the UK. There are a few experts out there. I had a gynaecologist basically say to me, well, PMS, PMDD, what's it matter if it's causing you loads of issues? It's causing you issues. What's it matter what it's called? And I agree. I think we should address symptoms, not a label. But equally, when I had a gynaecologist say to me, you meet all the criteria for PMDD, it was quite validating because it made me think that, oh, maybe I'm not just really crazy and all that sort of thing. And maybe I'm not overreacting to different things. So you can talk to your doctor about it, and you can talk to gynecologists about it and things like that. I think it's important to recognise though, and I'm not a fan of self-diagnosis. I don't think it's a good idea because we could all diagnose ourselves with a million things. We all meet the criteria for so many different things. I think it's worth a conversation, especially if it's really impacting your life, because there are options. A couple of symptoms that I realised that I've probably not mentioned are overeating and disturbed sleep. So if you can think about being in pain and then just eating non-stop and then getting more cramps and then not being able to sleep, and then the next day you're really fatigued anyway because of the PMDD and that sort of thing. So why do people get it? Well, it's recognised as an endocrine disorder. It's not a mental health condition as such, but you will find information about it on mental health websites because obviously the symptoms are very emotional and mental health based in part, but it is an endocrine disorder. There are links to other endocrine disorders. So there's not much research out there, but some of the research does create a link between things like, for me, I've got PCOS. So it's definitely more likely that I would have it. Again, I think a lot of the research is in its infancy, so we can't make giant leaps. However, there are some evidence that suggests that there's a link to there's a genetic link, and also there's a trauma and stress link. Not in that it causes it necessarily, but if there is a history and pattern of trauma and stress, then you are likely to have worse symptoms with your PMDD. So it's a very real disorder. So you might be watching this and thinking, that's exactly what I've got. So what are we going to do about it? So if you want to go down the diagnostic route because you need it and you want support and help, it's really important that I would say keep a diary. So keep a really clear diary over at least 3 months of your symptoms and how they manifest, to be able to evidence that all these symptoms are directly related to the luteal phase of your cycle and that they're not something else. Go armed with information about PMDD, go armed with your diary, and go and see your doctor. and explain to them, you think you might have this, what can they do to help? Now, it's often misdiagnosed as another mental health condition, so I think it's really important that when you do go, you're making sure they understand that this occurs during your luteal phase, and that you've kept a really clear kind of diary of symptoms for several months to be able to evidence that to them. In regards to ongoing treatment, it's mainly stuff you can't really, it's not that there's a drug that stops it, but they look at the symptoms. So they might give you SSRIs, which are serotonin something inhibitors. They might help. You can also have things like anti-inflammatories for the pain, oral contraception, other forms of contraception can help, because I think it's really important to also recognise that endocrine disorders and things such as PMDD are, and I hate this terminology, but it doesn't mean it in the emotional sense, just the biological sense, an oversensitivity to changes in hormones. So sometimes just tweaking those hormones is going to work. Self-care for me. So I don't have any treatment for it. I'm having treatment for PCOS at the moment, and we are currently also looking at tracking whether it's going to impact my luteal phase and whether the PMDD symptoms reduce as well, because some of the things cross over. But the focus for me is knowing it's coming, knowing what it's going to look like, and planning my life around it, like any kind of condition, really. And I know that's probably not the answer people want, and people do go to extremes to treat it, but it is just really, really important to recognise that you need to look after yourself. There are websites for PMDD, and you can get advocates to support you and things like that. And there are support groups and lots of different things. So whatever you need to do. But yeah, I think for me the most important thing was just working out that actually this is real. This is an oversensitivity in my hormone changes, the same way PCOS is, and we all recognise that as a diagnosable physical endocrine condition, and PMDD needs to be recognised in the same way, not just someone who's overly emotional, which there's no such thing as anyway. Be as emotional as you want. Yeah, so I know I've just talked non-stop, but I hope this is helpful for people who are asking about PMDD, and hope it will help you in your journey. If you've got PMDD or you think you have, comment down below. Maybe we'll have a chat in the comments, and let's make it more accessible and people more aware of it. Have a great day.